So I really want to thank Brent and Dale for organizing this, and really Cliff, Dr. Otto, for creating this and making it happen. If it wasn't for your persistence in our state, we really appreciate you. I especially appreciate you. So I am going to be talking basically, this is Herstory. It's a divine feminine history of cannabis. So I'm going to be really talking about kind of the role that medical cannabis has had for women. So let's see here. There we go. So this is what I'm going to be just kind of talking about. Um, the different ways that cannabis has been used predominantly for dysmenorrhea, painful periods, infertility, pregnancy, menopause, and kind of the future. So when we look at cannabis, it has been used for millennia, and especially for women. So some of the earliest writings out of Egypt, it was referred to as azalu, and I love this preparation. So it was cannabis with mint, saffron, and beer, and this was for difficult childbirth, also for the stain of menses. So if you were having like a prolonged, menstrual cycle, it was administered almost every single way that you can think of, orally, vaginally, rectally, also through fumigation. And I thought that it was really interesting that they had a lot of different topicals for eyes, and that was part of the Egyptian pharmacopoeia, where cannabis has actually never been taken out of, unlike here in the United States and in other places. So Persia was called banga. Some of the more interesting preparations were intranasal, and where the seed juice was mixed with a variety of herbs to treat migraines, and also for, again, we see it for dysmenorrhea, for painful periods, and to prevent miscarriage. Also used for gonorrhea, for anal fissures. So that's if you've had any tears after childbirth. And poultices were used also for hemorrhoids. China, referred to as ma, this is the symbol for it, and this is actually two cannabis plants hung upside down to dry. So the female plants were again, this is when we started to see a little bit more of the differentiation between male and female, and where they're starting to note that the females have a stronger concentrations of cannabinoids, and it was used again for menstrual cramps, and also for postpartum difficulties. And the cannabis juice and the root was used for retained placenta and postpartum hemorrhage. So, if you know anything about, historically speaking, childbirth was one of the number one, reasons for death in women, and retained placentas and hemorrhage were really large factors in that. And so this was something that was used to help. Moving on to Europe, it was referred to as Haynep. And this is a really interesting topic, because this is when we're seeing them kind of talk about breast cancer. So they're saying, rub the herb with fat, lay it to the breast, and it will disperse the swelling. And if there is a gathering of diseased matter, it will purge it. And then hemp seed was also used to increase breast milk production and to help with amenorrhea, which is when you're not having your period. And O'Shaughnessy, who was really one of the first European physicians to write extensively about cannabis, use the resin of hemp for uterine hemorrhage. So again, we're seeing it for hemorrhage, and also with childbirth. So the United States. So this is one of my favorite formulations that I have seen when it comes to for menstrual cramps. Because if you look at it, this is Dysmonine. It has not only does it have cannabis, but it also has capsaicin in it. And so, for all of us who study cannabis and cannabinoids and cannabinoid receptors, we know that that's directly related with the TRPV receptors. So having that included is really super interesting. So again, we're seeing it used for painful periods, but also for hyperemesis gravida. So that's when you have excessive vomiting during pregnancy. So this is where, we're seeing it used actually during pregnancy, and where there's indications for it. And again, during labor. And this is one of my all-time favorite quotes about cannabis. Cannabis indica does not paralyze the nerves, but strengthens them directly. It does not constipate by paralysis. It cures by its beneficent virtues. And I think we see a lot of that today, just in medicine. Cannabis has so few side effects and such a good safety profile. And then this is just some of the historical uses of cannabis for women. So again, we see it really, really heavily used during menstruation, for dysmenorrhea and for uterine fibroids. And also nausea in pregnancy, and used a lot in labor, as well as in the postpartum period. Nipple cracks, fissures, mastitis, and then for menopause, cystitis, and urinary retention and incontinence. And, this is a lot of also what I see in my clinic with my patients who are using it for painful periods. So I think it's really cool that it's something that we've really never stopped doing. So when we kind of look at where we're at today, when we look at painful periods, this is something that affects almost all women at some point of their life, 84% of women. So everybody who is in this meeting today, you know somebody, you might actually have painful periods, but or you definitely have crossed paths with somebody who has painful periods. 43% of those women have painful periods every month. So about half of the women are having painful periods. And 1 in 10 women have been clinically diagnosed with endometriosis. Cannabinoids have been shown to decrease pain and also decrease the spread of endometrial lesions in the pelvic region. So this was an animal study, and I think it's really important because there's not a lot of really effective treatments out there for endometriosis. So really exploring that a little bit more would be great. Cannabis and infertility. So women who have unprotected sex, who don't become pregnant, who want to become pregnant within a year, typically have some form of infertility. 12% of all women in the United States have difficulty getting pregnant or carrying a pregnancy to term. and women who are trying to conceive should seek treatment. And if they're under 35 at 1 year, if they are over 35 at 6 months. THC can inhibit the implantation of the embryo in the uterus. So I think that using cannabis, if you are trying to conceive and you are having difficulty with conception, it's something that you might consider either cessation or using it differently, like topically, things like that, something to discuss with your provider. Cannabis and pregnancy. So as you know, it's very controversial. I get asked about this on definitely a weekly basis. Somebody is asking, hitting up my DMs on social media. So it is very controversial. I have always said the most dangerous part of using cannabis in pregnancy is the involvement of CPS. It's definitely the most dangerous part. But, there are things to consider. So when we look at the research, and there's no other co-founding factors like alcohol or tobacco use, what we see is that it can decrease the birth rate by about 79 grams. So not too much, a little bit of a decrease in birth weight, and it may contribute to ADHD. Cannabis can also aid in hyperemesis gravidum, and that's where I've seen it be most effective with women who are pregnant. Cannabis and breastfeeding. So again, kind of limited, smaller studies. But what they've shown is that there's no difference in growth, mental or motor development. The half-life of THC in breast milk is about 27 hours. And estimated intake for infants is about 2.5% of what the mother is ingesting. So really, the take-home message is that dose matters when you are using THC in breastfeeding, because the larger amounts of THC that you use, then the larger amounts are going to be passed on to your infant. And so typically, we do recommend decreasing the amount of THC that's used and just using it in moderation and just kind of as needed. Cannabis for menopause. So CBD, CBG, and THCV can strengthen bones, kind of decreasing the risk of osteoporosis. This is some really compelling research that I think has a lot of really, really good potential. And, as we know, cannabis can increase serotonin levels, which can help to decrease hot flashes, and some cannabis products can be used for lubrication, and that can just help if you have painful intercourse. So the future is female. So when I was doing a recent PubMed search, there are basically 0 articles on cannabis and dysmenorrhea, even though we know that there is a ton of reasons why they should be doing this type of research. Even less, only 3 articles when it comes to cannabis and menopause, 34 articles on cannabis and breast cancer, and 644 articles on cannabis and pregnancy. And a majority of them, were focused on, some of the perceived negative impacts that weren't necessarily true, but were based more on stigma. So what would I like to see moving forward? Really, product really good, solid product development for dysmenorrhea. Foria in California, I know they were doing a study. And how can, you know, we be a part of supporting women in cannabis? You know, there's a lot of cute shirts going around that say "buy weed from women," but just really supporting women in this industry is super important. And that's it.
That was awesome. Thank you so much, May. We're over our time.
No
I
worries.
like, you did great. Thanks for helping to catch us up. And I just want to say thank you to the other presenters who are standing by. We're going to go ahead and look to our next presenter.